At Donnelly Dermatology, what are you going to get in terms of treating common skin conditions that you won't get at another dermatology practice? With the extra time, you're going to have a very thorough exam, very thorough history, and I'm going to have time to answer all your questions, and we're going to collaborate on your treatment plan. One of the most common conditions we treat is eczema, which is an inflammatory disorder that usually presents as red, scaly patches that are very itchy. It can be hereditary. There are actually a lot of treatments available now that can make patients very comfortable. Topical steroids, nonsteroidal topical medications, and there's actually some new, what we call biological therapies that are targeted therapies that work more systemically with your immune system and have been miraculous game changers. Psoriasis is another common inflammatory skin disorder. It can range from mild to severe, often a hereditary component, but plenty of people don't have any family members. It can be uncomfortable, although typically it's not as itchy as eczema. The great news is the newer treatments are pretty amazing. Everybody hates warts. Warts are ubiquitous. Most of us will have a wart in our lifetime. They are caused by different types of the human papilloma virus. So these are viral infections. You cannot cut out a viral infection, so we don't. The first thing we usually do is freeze the wart with liquid nitrogen, depending on where the wart is. The location is important. If that doesn't work, we can move on to injections of Candida antigen, which are basically there to stimulate your own immune system to kick the virus out of your body. There are topical creams, and imiquimod is one, which does the same thing. Then there are even chemotherapeutic creams that we use in combination with something called salicylic acid, especially for like really difficult plantar warts, which are in the bottom of your feet. I would be remiss in not pointing out the importance of genital human papillomavirus, because that is a form of wart that can actually lead to cancer. It is crucial that women get pap smears with PCR tests. There is a vaccine now that most of your kids have probably gotten, but it is available to adults, and it's constantly being modified, and new dangerous strains are constantly being added to make that vaccine more effective. At most dermatology practices, because they only have 10 minutes or so to give you, you can deal with one issue and then you've got to come back for another appointment. At Donnelly Dermatology, you can address multiple concerns in one visit. You can even have a biopsy the same day if needed. That is a very unique aspect to this model of dermatology. You are going to walk out feeling that you just had all of your questions answered and feel very secure that you are going to get the best treatment possible. And we are always available if you have forgotten a question and you want to give us a call.